Hi, my name is Joan Kaufman. I'm one of the developers of the KSADS-COMP Child Psychiatric Diagnostic Assessment Tools. Thanks for taking a few minutes to watch this video. The paper and pencil KSADS served as the blueprint in the development of our web-based tools. The paper and pencil KSADS is one of the most widely used child psychiatric diagnostic assessment tools in the world. It's been translated into more than 30 different languages and has been cited in more than 12,000 peer-reviewed publications. So what is KSADS-COMP? First of all, it's very comprehensive and assesses all the major child and adolescent psychiatric disorders from ADHD, depression, PTSD, autism, substance use, and more. But what's important, it has easy module selection. You do not need to do the instrument in its entirety. It also assesses critical factors that are important in evaluating safety and treatment planning, things like suicidality, access to firearms, and the other things listed on the screen. It's currently available in 10 different languages, and it generates instantaneous item response, diagnostic reports, as well as a modifiable comprehensive mental health evaluation that pulls in all the data you can get with the KSADS that can be billed using the CPT codes noted on the screen for rates between $166 to $197 with Medicaid reimbursement. There are two central tenets to the KSADS. One is diagnoses matter. The same symptom, like inattention, can be associated with multiple different diagnoses that have very different treatment implications. So inattention could be ADHD, depression, bipolar, PTSD. Differential diagnosis is something that really matters with the KSADS. Another central tenet of the KSADS is understanding the context of a child's life is essential for diagnoses and treatment planning. So the introductory interview assesses lots of things to get a sense of the positive, child involved in sports, negative, they may be being bullied, or they may have had significant losses. There are three different versions to the KSADS-COMP assessment tools. There's a clinician-administered KSADS-COMP, which is closest to the paper and pencil interview, but then there are also two self-administered versions. There's a caregiver self-administered and a youth self-administered version, which has video clips to facilitate administration, with the youth version being appropriate for children 11 and above. And the self-administered version's very valuable in situations where there may not be mental health professionals, like in pediatric offices. The self-administered KSADS-COMP has the same components as the paper and pencil KSADS. It has an introductory interview that gives you everything you need for a comprehensive mental health evaluation. Then there's a diagnostic screening interview that surveys 2 to 4 symptoms of each of the diagnoses assessed with the KSADS, and the supplements that are only administered if skip-out criteria are not met. So this really does help to facilitate differential diagnosis. All right, let's go to our website. And you would not have to see as many different folders. And I'm going to start with the self-administered KSADS. And so I went with the unused, and then you can see you put a patient ID, but we do not use any protected health information. So you might use the date or a medical record number, keeping it confidential. All right, and then I'm just clicking here to start. And as you see, you can pick your language that you want. You can also choose which modules, so you don't have to do the whole thing. We don't actually assess autism by the youth. We only get the parent report. And then you can see, you can copy. This is a unique URL. If it's not going to be done in your office, you can send it either by email or text, or if it's integrated into the medical health record through MyChart, or you can start the interview. And as you can see here in the youth, there are those video clips.
Hello, my name is Dr.
Can pick either male or female interviewer.
Hello, my name is Dr. Joan Kaufman.
Hi.
Thank you for agreeing to do this interview.
You can also hide the video if you want. And it's written at a 5th grade level. So I'm not going to walk us through the whole interview now, but you get a sense of what the interface is like. And what I want to show you now is some of the reports that are generated with the KSADS-COMP. All right, so you saw how little time it took to get the URL and send it. So they can be completed remotely as opposed to in your office. And with just the amount of time it took to send the link, let me show you the amount of information that you would have. So as I said, you can have an item response. And you can see, if you want to review item by item, everything that the parent or the youth answered. So the left column here lets you know what section. So here we see their introductory interview. And if you want to look at a particular diagnostic area, how did they respond to the depressive items? So you can see item by item. You can also look at the diagnostic reports that were generated with the parent or the youth, and you can see this youth met criteria for major depressive disorder. It lists all the symptoms that are present, alcohol use disorder, and post-traumatic stress disorder. But in addition, we can also create, as I mentioned, that mental health evaluation. And you can choose your pronouns. And for this youth, we're going to use the they. And you can see with next to no time, you have a draft of what would be required for billing and for charting, a modifiable mental health report that gives you the identifying information, how old the child is, who they live with. Here we see the child's father passed away. So all this information just gets pulled in, really leveraging technology to save clinicians time. We have information about school. We see they've had a drop in grades, what extracurricular activities they're involved in, the developmental history, born premature, developmental milestones or normal, mental health treatment history, whether there's guns in the home. And here we have a little reminder, they're kept unlocked, the importance for the clinician to follow up, trauma history, relationships. There is a blank mental status exam because that is required for billing, and so that you would complete with a brief interview after reviewing everything. And you can see here the diagnostic formulation. You see which diagnoses were met, which symptoms, and then the treatment formulation is left blank. All right. So again, just running through, we saw how you can select language, you could select the modules you want, and you may choose, if you're doing it with a younger child, you only want the parent to do, ADHD, separation anxiety disorder, you can choose. All right, we saw how you can send the link. And we also saw how in the youth version, it was, we had the video clips, which facilitate administration. And then you can also see here what the instrument looks like for the parent on a smartphone, so that even if they don't have a laptop or an iPad, it's readily available to be done on a smartphone. And then we saw the KSADS-COMP generates multiple reports that are very useful to clinicians, save an enormous amount of time, and allows them to make decisions regarding finalizing diagnoses and treatment planning based on the reports available. So the clinician-administered KSADS-COMP has those same three elements that we talked about, but to streamline it, we've made a self-administered pre-interview. And remember how we talked about how the diagnostic screening interview has 2 to 4 symptoms in each different diagnostic area? The self-administered pre-interview can be sent out to the parent and youth before you actually meet with them, and it will survey the current symptoms associated with those screen interview. And you can review them prior to sitting down and meeting with them. And they are also going to show up on the screen when you're doing the interview. So again, you may say, I don't need to ask about certain things because I've already had the parent and youth tell me this is not a problem. So it really does streamline. So when you log into for the clinician administered, you see there's more columns here. We have the pre-interview for the parent, the pre-interview for the teen. We have the teen interview, the parent, and consensus. And so like the paper and pencil interview, the clinician administered KSADS-COMP is designed to be an integrated parent and youth assessment. Then you pull it all together because we do know our best diagnoses are when we get input from both informants. And you can see here, before you meet with them, if they had done the pre-interview, you already have a sense this kid is pretty clinically depressed. They're feeling depressed and cranky nearly all the time. We know when it started. So this really does streamline your direct interview process. I talked a little bit before about what's included in the introductory interview. It's really everything that you would want for a comprehensive mental health assessment. So the information about demographics, health history, prior psychiatric treatment, family history of psychiatric illness, things about adaptive functioning, how they're doing in school, peers, and activities. And again, those things we talked about, that increased risk that you want to know about guns in the home, gender identity, sexual orientation, bullying. And just as a note, some of the information we only get from the parent. We don't bother asking the youth about health history, prior psychiatric treatment, family history, etc. All right, so characteristics of the clinician-administered KSADS. It is designed to be semi-structured, administered in a conversational style. Probes don't need to be recited verbatim. You can make stylistic changes. Sometimes you can even omit questions because you've gotten that information from your introductory interview or the pre-interviews that were completed. It is designed to be a multiple informant interview. It's best when the same person interviews the parent and the child. And with young children, we always recommend starting with the parent. All right, so this is what your dashboard looks like in the clinician-administered KSADS-COMP. So after you do that introductory interview where you find out who they live with and other such things, you will see on your screen these various different modules. So with a self-administered, you may select ahead of time which modules you want to have administered. With a clinician, you can choose as you go. So you might have thought you were only going to do 3 or 4 of them, but something came up in your interview, so you can pick. So as you can see, the green means it hasn't been done yet. Blue is it's completed, but we weren't at threshold, so the supplements aren't needed. Gray is a criteria symptom was met and supplements are required. So if anyone here has ever done the paper and pencil KSADS, I used to keep little notes, which supplements do I need to do? This is all automated. Okay, and this is what a screenshot of what it would look like if you were actually doing the interview. Currently doing the interview with a parent, having already interviewed the teen, you're asking a question about the child feeling irritable and annoyed within the depression screen, and you can see the child already told you they felt that way all the time. The parent on the pre-interview told you that the kid's that way. You're going to go through this much faster. You're going to say, it sounds like Johnny is feeling cranky and annoyed most of the time. So you can score it quickly. And you can also write comments. If the parent tells you that the child punched a hole in the wall the other day, you can type that up and that will be included in your item response. Again, we've got the same reports that we saw before. And if you have any questions, you can certainly feel free to email me and to follow up.